স্ট্রোক, পার্কিনসন্স, মুভমেন্ট ডিসঅর্ডারের আসল লড়াই। ডাক্তারবাবু কি বলছেন?
There are several diseases can present like a movement disorder.
Any damage in nerve is always irreversible.
No, it's a myth. How much we are doing the exercise.
Early rehabilitation is like golden window.
The first 3 to 6 months is very, very important.
Physiotherapy, occupational therapy, sometimes Botox.
Many people get confused what type of therapy.
Deep brain stimulating.
Abnormal dance like movements they'll develop it. This will be a game changer for people with Parkinson's disease.
You said many things are reversible.
We have a stroke network. We should not treat a patient as a patient.
Right.
We should treat the human.
স্ট্রোক, পার্কিনসন্স বা এই ধরনের যে কোনো সিরিয়াস নিউরো অসুখের পরে সময়টা যেন থেমে যায়। কারণ হাত পা কথা বলা অনেক সময় অন্যান্য নানা অঙ্গ প্রত্যঙ্গ নিজের বশে থাকে না, থেমে যেতে হয়। এই থেমে যাওয়ার জায়গা থেকেই শুরু হয় মুভমেন্ট ডিসঅর্ডারের আসল লড়াই। এই নিয়ে চেন্নাই অ্যাপোলো প্রেজেন্টস ডাক্তারবাবু কি বলছেন। ডাক্তারবাবু ঠিক কি বলছেন আর জেনে নেব দ্য ওয়াল আরোগ্যতে। আমি তিয়াস এবং আমার সঙ্গে রয়েছেন চেন্নাই অ্যাপোলোর সিনিয়র কনসালটেন্ট নিউরোলজিস্ট অ্যান্ড মুভমেন্ট ডিসঅর্ডার স্পেশালিস্ট ডক্টর জয়শঙ পি। ওয়েলকাম ডক্টর।
Thank you.
স্ট্রোকের পর শরীর কি আগের অবস্থায় ফিরে আসে? কতটা আসে? কিভাবেই বা আসে? জেনে নেব সবটা। So doctor, my first question will be like, any neuro serious problems like stroke, Parkinson's, any other things, they often lead to problems with mobility, right? Why does so happen, and what are the exact movement disorders one patient may face?
See, if you look at the movement disorders means it's a huge, there are several diseases can present like a movement disorder, like a Parkinson's disease, or it can be a dystonia, or chorea, or myoclonus, or ataxia. These are even tremors. There are all these things are called as a movement disorder.
Big umbrella.
Yeah. So the important thing out of this, the most common are Parkinson's disease, tremors that can also affect the patient's movements, as well as stroke. Stroke in two ways it can affect. One, if somebody has a stroke, what we call it as a paralysis, it can affect the hands and legs, so they will have difficulty in walking. Their mobility will be affected. At the same time, even Parkinson's also, they can have difficulty in walking. They can frequently they will fall. All these things will be affected. Sometimes if the stroke affects the brain, especially the area called a basal ganglia or its connections, sometimes the patient can also, a stroke can also present like a Parkinson's. It's called as a Parkinsonism, vascular Parkinsonism, stroke-induced Parkinsonism. So all these things can affect the mobility.
Okay, but many people think that any damage in nerve is always irreversible. It can't be recovered. Is it true?
No, it's a myth. Many people think, because they think once they develop a stroke or anything, they'll think that, okay, that's it. I have to live with the paralysis. It's not like that. The brain is an amazing organ, because the brain, it is called as a neuroplasticity. Neuroplasticity means if a stroke or any damage to the brain happens, after some time, the cells surrounding the damaged area learn the work what the damaged area is doing. So slowly it will recover and take care of the damaged area's work, and it will work as good as the damaged area. Similarly, like if I have a paralysis, okay, first initially 1 or 2 months I may have a little bit of difficulty in moving the hands, but because of neuroplasticity, the brain, the surrounding tissue learns this activity and it takes care. Slowly, many people with a good physiotherapy and occupational therapy, they will start walking, they regain the power. This is called as a neuroplasticity.
Okay, so brain can relearn, right?
Relearn.
So how much can brain relearn even after like stroke-like situation? How much?
So the important thing is how much we are doing the exercise, how much effort we are going to do it. If it is going to be a small stroke, the patient, small or medium, the patient can regain the whatever the lost control, everything they can regain in 1 or 2 months. but sometimes it may take 3 months.
Okay.
But if it is going to be a large stroke, if they do significant physiotherapy exercises, they can almost regain whatever the weakness, whatever they got it, they can get it back.
Okay. There are so much kind of post-stroke symptoms like difficult walking, tremors, weak grip, or any kind of spasticity like that. So, which symptoms have the highest possibilities of recovery?
This is very important.
Yeah.
Because people think that whatever the problem they have got it, they will not recover.
Yes.
But the important thing is, stroke can affect from the brain to legs. So it can affect the speech, it can affect the hands, it can affect the legs, and at some point of time they'll develop a spasticity also. The first thing is, if somebody has a weakness, like they cannot lift the hand and leg,
weak gripping
everything. So the weakness will improve very well.
Okay.
Especially if you compare the hands and legs, so for many people, depending upon the area where it was affected, it can vary, but the leg weakness improves better than the hand weakness. Especially the movement, the proximal muscles will improve first, and then slowly later on the distal movements, the fine movements will take
bigger
slowly.
Muscle will do better.
Yeah, the simple
Rather
words,
faster.
faster.
Okay.
So then subsequently people will have as tremors or other things. Slowly it will improve. Speech also, first the hand and leg will improve with a good speech therapy. Slowly the speech also will improve. So everything step by step will improve.
And there must be very crucial thing is time. Because experts often say that the early rehabilitation is like golden window for any kind of neuro diseases like stroke or anything. So it must be golden. Like, how does it work?
The important thing is, as I told you earlier, the neuroplasticity. The first 3 to 6 months is very, very important. The more the exercises, the more the physiotherapy you do in the first 3 to 6 months, the recovery will be faster, because the brain is like a what we call it as it can remodel. Whatever the exercise you do, whatever the input we give, so it remodels and learns faster in the first 3 to 6 months. After 6 months to 1 year, the adaptivity will slowly to reduce. So the recovery will slow down. But after 1 year, the chance of recovery is very less. But still, you may get some improvement. So that's why what we call as a golden period, the first 3 to 6 months is very, very important. So many people think that whenever they have pain, they have some difficulties, they will ignore that. The first 6 months, they'll think that they'll do very few physiotherapy.
They just suffer and wait.
Suffer, they will leave it. But they doesn't recognize this is the important period. They have to work hard. If they do more physiotherapy and exercises, the recovery will be fast. But after that, after 6 months to 8 months, then they'll realize, I'm not improving. Then they'll put the effort, but the recovery may not be as good as the first 6 months.
Okay. Sir, when after mishap the therapy starts, there are so many options like physiotherapy, occupational therapy, sometimes Botox, and like many other things. So where should a family realistically begin to start the therapy and all? What is the major thing to know that I need this, my patient need this? And
see, the important thing is always many people get confused what type of therapy they need to get it, because the first, if anybody has a severe weakness, first we'll subject them to the physiotherapy, especially if the weakness is more on the hands and legs. If there's a large muscles, we'll push more for physiotherapy, and then slowly when they recover, then especially the small muscles, the small and the toes, all these things, the fine grip like writing or buttoning or something, pinching, taking something,
fine motor
skills. For that, the occupational therapy is most useful. So the physiotherapy initially, as I told you earlier, the large muscles will recover fast. The fine motor skills is very, very difficult to regain. So we will push them for physiotherapy. For some people, if it takes longer time, if they have a severe weakness, so it takes longer time. For those people, we'll always see first, we'll start with a normal physiotherapy. We know that these guys may not recover well. They may take, because the stroke is bigger one and lots of weaknesses there. So for those people, we have robotic physiotherapy nowadays in Chennai. So this robotic therapy, it's a robotic machine that helps you to do the physiotherapy. If they are not able to stand, it helps to walk on the like a gate, like a what the gate mat we have. Like this will really help them to recover fast.
Okay.
When the severity is more, we always inform them to go for the robotic therapy yearly. So good robotic therapy will recover them fast. But after 3 to 6 months, when the symptoms improve, they will develop the stiffness of hands and legs. They will have a stiffness. If you see, many people will have hands like this after the stroke, and they walk. They will have a stiff walk like this. They will have circumduction gait, what we call. For those people, if the hands are becoming stiff, if you do a physiotherapy, it is difficult for them to flex and extend.
It will pain.
And also, they'll have lots of pain. If you have pain, if you ask them to do exercise, they will not do. Because of pain, they will be suffering. So in those patients, if you give the Botox injection, the injection will loosen the muscle. So the physiotherapy will be really comfortable, and also the recovery also will improve.
So there's a holistic process interrelated with each other.
Yes. We have to give it everything at the same time.
And if I come to more advanced treatment like deep brain stimulating for Parkinson's or like Parkinson's disease, when do you consider a patient that he or she needs the treatment? I mean, does everyone qualify for this kind of advanced treatments?
No, like as you told that Parkinson's disease, when Parkinson's disease, usually they'll have a slight tremors, stiffness of hands and legs, or difficulty in walking, or they'll become very slow in walking. When the disease is very early, like 1 to 4 years, usually they may respond very well with medications itself. But when they cross beyond 4 or 5 years, the amount of tablets to keep them active will increase. First, initially, the first 2 to 3 years, we'll give only 3 tablets or 4 tablets per day. But when they cross 4, 5, 6 years, they require more medication. They require at least like every 3 hours or every 4 hours, they require tablets, 2 or 3 different type of tablets to keep them active. When they take more tablets, obviously they'll have some side effects like dyskinesias. When they take more medication, they'll develop a dyskinetic abnormal dance-like movements. They'll develop it. So if you give more tablets, they'll develop abnormal movements. If I reduce because of the movements, if I reduce the medications, they cannot walk. They cannot do their activities. So for that, if they cannot do the activities, I need to give more medications. So we are caught in between. I cannot increase the medication, I cannot decrease the medication also. In those circumstances, after 4 years, we will do the advanced therapies like deep brain stimulation. Deep brain stimulation is one of the best treatment options available with people with Parkinson's disease.
What happens in this treatment?
If they have a lot of tremors, it controls the tremors significantly. It improves the slowness and stiffness of the hands and legs, and the walking also will improve. It reduces the medications up to 40 to 70% of the medications can be improved. And as I told you, the abnormal movements, that also will improve. So overall, the motor symptoms, as I told you, tremor, stiffness, slowness, rigidity, these are all the major hindrance for people with Parkinson's disease. All the motor symptoms will really improve. And this will be a game changer for people with Parkinson's disease. It improves the on period, the active period significantly. So many patients feel that they have gone up to like almost at least 4 or 5 years back, almost as good as their normal time.
सर, होता क्या है जब भी कोई मिसअप हो जाता है, हमको नहीं पता होता है कहाँ जाए, क्या क्या मिल सकता है, क्या क्या हो सकता है. जैसे you said many things are reversible, but we think that brain damage never recovers like that. तो इतना सारा इंफॉर्मेशन ये मिलना और क्या क्या हमें अवेल करना है, ये जानने के लिए कोई कॉमन नेटवर्क होता तो हम यहाँ जाए, स्ट्रोक सपोर्ट मिल जाएगा. ऐसा कोई इनिशिएटिव है क्या चेन्नई अपोलो से?
Apollo is one of the world's best center in India, probably one of the best in India and also one of the best in among the world. We have a stroke network. This network has like a stroke, we divide into 2 things. One is an emergency, time is brain. So we connected almost all the Apollo hospitals in Chennai. If somebody has a stroke, the time is brain. So within 4.5 hours window, the golden period, if they reach the hospital, we can give the injections like thrombolysis, the clot busters, the injection. So we can increase the blood perfusion and open the clot and then increase the perfusion.
Immediately the clots open.
Clots open, so the blood supply is restored. But if the blood vessel blockage is more, sometimes many people may not able to reach the hospital within 4.5 hours, or if they have lots of big clots. Sometimes we can go up to 24 hours. If there is a big clots out there, we can do a thrombectomy. Thrombectomy is similar to the cardiac stenting, like what we do it for the heart. Same like that, we do a stent and then remove the clot. That's called as thrombectomy. So we can do it up to within 24 hours. So these advanced settings are available in, these advanced treatments are available in Apollo Chennai. And also we have launched the Tamil Nadu's best center for Parkinson's disease, and advanced, we give the advanced therapies like deep brain stimulation, apomorphine, and the biggest plus point is this is a one stop for all the neurological problems. Many people with a Parkinson's disease or stroke, they can have a heart problem, they can have a diabetes, or sometimes they can have some memory problems, psychiatric problems, or speech and swallowing problems. Also, sometimes they can have gastro problems. All these things can have. So here in one center, we have the like a state of the art, all the facilities we have, and also one of the best specialty doctors are available. So if you come to one place, almost all the problems we can take care of it. Also, not only that, subspecialty is also available. The advanced rehabilitation, the exercise physiotherapy, that's what more important for all these things.
Everything
in
each
one
and every
center.
step in one center.
So the important thing is, if I take just stroke alone, if I leave the other part, the patient may not have a good improvement. So as a holistic, as a whole, we have to treat, we should not treat a patient as a patient. We should treat the human as a whole. If you treat everything, the recovery and the outcome will be really good.
And that's fantastic. And thank you, doctor. Thank you for your insight and thank you for your time. ধন্যবাদ আপনাদের যারা এতক্ষণ এই এপিসোড দেখছেন। স্ট্রোক মানেই নিউরোলজিক্যাল সমস্যা মানেই থেমে যাওয়া নয়, ব্রেনের সমস্যা মানেই তা ইররিভার্সিবল কখনো নয়। সঠিক গাইডেন্স, রিহ্যাব এবং ডাক্তারবাবুর পরামর্শ একসঙ্গে যদি মেলে, তাহলে কিন্তু শরীর আবার ফিরতে পারে ঠিক আগের মতো। এই এপিসোড আপনাদের ভালো লেগে থাকলে লাইক করুন, কমেন্টে মতামত জানান এবং অবশ্যই শেয়ার করে অন্যদের জানতে সুযোগ করে দিন। ততক্ষণ পর্যন্ত দেখতে থাকুন দ্য ওয়াল, কারণ খবর এখন এখানেই।